You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello everyone and welcome to the Dental Zone. I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia. I have over 30 years experience in dentistry and have been practicing holistically since 2000. If you'd like to know more about what holistic dentistry is and the link between your health and your oral health, then you can hop on over to holisticdentistry.au, or you can check out my dental practice website, evolvedental.com.au. And welcome to year 2 of the Dental Zone podcast. This is episode 53. I've been doing one episode a week for the last 12 months, and I hope you have been enjoying them and that they've given you value and food for thought and helped you to have a better understanding of how important the mouth is to the health of the rest of your body. Now, I am continuing in my series on how to improve your oral and overall health, and in this show, I'm going to talk about gum disease. Now, gum disease is very prevalent. It affects the majority of the population to some degree or another. And in its more moderate, and I don't like that term, in its more advancing to severe state, gum disease is not only something that's going to cause you pain and suffering and tooth loss, but it puts you at risk of many systemic health issues such as heart disease. So we really need to talk about what gum disease is, what causes it, what it does, the implications of it, and how to treat and prevent it. So let's get into it. Let's get into the zone. Now, you've all probably heard the term gum disease, but this bothers me because people are not really then grasping what this term really means. If I say, oh, you've got a disease of your gums, you might think, well, yeah, okay, I'm not happy about that, but so what? What does that mean for the rest of me? If it's just affecting my gums, then surely it's not that significant. But gum disease doesn't just attack the gums, but it also attacks the ligaments that hold your teeth in place and the bone that surrounds them. Periodontal disease, periodontal disease means disease around the tooth, and that is a more accurate description because it includes the damage that is going on to the ligaments and the bone around the teeth. And I'm going to swap between gum disease and periodontal disease as I talk. It's just what happens. But when I say gum disease, I want you to understand that I'm talking about the structures around your teeth. So that's the gum, the ligament, that's like a membrane that holds your tooth into your bone, and the bone itself. So it's really important that you understand the proper terminology, because then you can communicate that properly with your dentist and dental hygienist. And that you know that when they're saying these words, you know what they mean. Now, there are 2 main stages of periodontal disease. The first is a disease of the gums, or gingiva, and this is called gingivitis. Now, we consider that to be inflammation and disease of the gum tissue alone without any damage to the underlying ligament and bone. And we consider gum disease an early warning sign. It is a disease. It is also an early warning sign that things that are going awry. And if it can be caught at this stage, it is reversible. The second stage is called periodontitis. And this is the disease of the ligament and the bone that holds your teeth in your jaws. These 2 forms of periodontal disease are the most serious forms of dental disease. They've not been given enough recognition by the public or the profession itself for the destruction that they can cause. Tooth decay wounds the tooth. But the real killer of teeth is periodontal disease. Decay is considered something, that it's bad, but we can fix it. And when you have decay, it's not affecting the surrounding tissues and it's not affecting the rest of your body. Although if you're getting tooth decay, it is a sign that there are some systemic issues and systemic imbalances, which I covered in the show before this one on the truth about tooth decay. Most tooth decay can be repaired. But the problem with gum disease is once it's advanced, it destroys the bone that supports your teeth in the jaws, and at that point it is now irreversible. The damage that has been done cannot be reversed. It can be stopped, it can be slowed down and mitigated, but it can't be put back. Once that bone has been destroyed, it is gone forever. It's one thing to think you might have a little gum problem. It's another thing entirely to realise that this disease is actually destroying the tissues, the ligaments, and the bones of your body. If you knew that this was happening, say, in your arm or your leg, for example, where the ligaments and the bones were slowly being destroyed and would eventually be lost because of infection, you'd be very concerned, wouldn't you? Surely you would. What would you do? And you'd do anything you could to treat it. Am I right? I think for most people, if I said to you, you've got a really nasty infection in your arm, it's destroying your bone, and if we don't do something, you're going to lose your arm, you would be, hell, doctor, just tell me what I need to do, let's get it done. Well, the tissues and the ligament and bones in your mouth are every much a part of your body as your arm would be. But why is it that we have this disconnection? Why is it that we think it's okay to lose a tooth, it's okay to have gum disease? And when I say we, I'm not just talking about general people like you, the patient, but I'm talking about dentists. I'm talking about this attitude in dentistry that it seems to be okay. Oh, your gums just bleed, don't worry about it. Brush and floss more. They should be worrying about it. They should be conveying the seriousness that it's not okay to have blood when you spit out, because that is a symptom of disease. Now, what causes gum disease? What causes periodontal disease? Now, I've just touched on some of it, brushing and flossing. So you may be told, or you might know, that the cause of periodontal disease can be poor diet, bacteria, your genes, plaque or calculus, which is tartar buildup. And there's truth to all of these. But when you get right down to it, the primary cause of periodontal disease is poor oral hygiene. Now, there are factors which will increase your risk for periodontal disease, and they are poor diet, poor nutrition, smoking, stress, poor lifestyle, lack of sleep. Clenching and grinding your teeth will accelerate already active gum disease. But you can offset these lifestyle factors by good oral hygiene, and you can support your gum health with your lifestyle factors. There are also systemic health issues that can increase your risk for gum disease. One of the main ones of these is diabetes, and type 2 diabetes now is rife. Type 2 diabetes is something that can be prevented and treated very easily with changes in diet and lifestyle. Now back to gum disease. Whether you have gum disease or not, you've got to know how to prevent it. If you've got this disease, you probably didn't know how to prevent it, or you didn't care, because so what? Big deal. But this is no excuse, because I see so many patients who are ignorant of the fact that they've got gum disease, or they know they've got gum disease, but they don't appreciate or understand the severity of the condition that they have. And there's still this lackadaisical, she'll be right, which is a very Australian term, or everything's going to be okay, or, oh, surely it's not that bad because I'm not in pain, doc, attitude. Well, poor oral hygiene is the main cause of periodontal disease. And as I've said, there's other significant factors that affect its onset, its extent, and its severity. And this depends on the type of bacteria that you have, your general health, your genetics, your immune response, the bite and bite forces, your age, your diet, your lifestyle, such as smoking and alcohol consumption, stress, side effects of drugs, and your relationship with your hygienist and your dentist. And a lot of these things you can take charge of. A lot of these things can be changed. Yes, you can't change your genetics, tick, but you do not have gum disease because it runs in the family. You have gum disease because it hasn't been dealt with effectively. Heart disease runs in my family, but I do not have any markers for heart disease because of the way I address my lifestyle and my diet. So you can't just go, oh, well, grandma had gum disease and lost all her teeth. My dad had the same, and my mum. There's just nothing I can do about it. Yes, you are at greater risk, but no, there are things you can do about it. Well, let's come back to that. And let's start by classifying gum disease. So you've heard me say gingivitis and periodontitis. Periodontal disease is complicated by the fact that different types of disease can exist in different areas of your mouth at the same time. The severity of gingivitis and periodontitis can vary from one tooth to another, and even from one part of that same tooth to another part of it, meaning that different stages of disease can occur at the same time around the same tooth. With periodontal disease, there is no clear-cut visual way for you to tell exactly when irritation and inflammation turn into gingivitis, or when gingivitis ends and periodontal disease begins. Most forms of gum disease progress slowly, and there's no way for you alone to accurately determine how severe your disease is without a detailed examination and what I call pocket charting or gum charting, or the recording of pocket depths, which are measurements of the gum health that must be done by your hygienist or your dentist. Now, if you've never had a pocket chart where the dentist or hygienist measure around your teeth and call out lots of numbers, you have got no way of knowing what's going on with your gum health. And quite frankly, I would consider your dentist and hygienist grossly negligent for not carrying out this routine and necessary diagnostic testing that I do with my patients every year. I will do one gum chart for every single patient once a year. For my higher risk patients, they get that at every checkup, and they get a randomized, what we call spot probing at every visit to make sure we are not missing anything. It is so important to diagnose correctly. Let's look at gingivitis. Gingivitis is the most common form of periodontal disease. In simple terms, itis means inflammation, gingi or gingiva means gum. So this means inflammation of the gum. Inflammation of the gum tissues. Uncared for, the inflammation turns into a more serious form of infection and eventually evolves into periodontitis. The most common way to classify gingivitis is by cause and severity. Generally, it has 3 stages. For example, if you're in the 3rd stage, you have the most serious form, and your dentist and hygienist should be able to guide you in determining what is causing your gingivitis and what stage you are in. But it's important to be familiar with the most common types. And the thing is, we've got all these different classifications depending on where in the world you are, and we don't have a standardized terminology. However, there are standardized factors or diagnostic clues, and let's go through those now. So I'm going to say you've got simple gingivitis. Over 90% of all people have had, have now, or will have this form of gum disease. It can occur around one or all of your teeth. The first sign is that the gum has a reddish, shiny band that is seen at the point where the gums meet the teeth. In the early stages of the disease, the gums may not bleed, but they will start to bleed as the disease progresses. The condition can arise in as little as under a week if the teeth and gums aren't cared for. If caught soon enough, you can treat this yourself with the right attention, and depending on how serious it is, it should heal within 1 or 2 weeks. If you can't reverse this process in this amount of time, you'll need help of the dentist or your dental hygienist. Chronic gingivitis. At this stage, the disease is no longer simple. Chronic gingivitis is like an old tree with widespread roots that are buried deep and wide and difficult to remove. This is a common form of periodontal disease in patients who brush enough to keep the disease from moving rapidly, but not enough to actually stop it. The rate this disease progresses will be a direct reflection of the amount of time you spend taking care of your teeth, your diet, how fast you form plaque, and how efficiently that plaque is removed. Generally, the areas of the mouth that receive the least attention are the ones that are going to be the most affected. Again, this stage of disease may not be painful, but there definitely is inflammation and infection, and bleeding will take place occasionally. It's important to note that the degree of bleeding isn't always an indication of the severity of periodontal disease. Like I said earlier, pain or no pain or amount of pain is not a good indication, and the same here applies to bleeding, whether it's a little bit, no bleeding, some bleeding, a lot of bleeding. That is only one aspect of gum disease, and it is not taken as, well, they don't bleed, so everything must be okay. Then there's acute gingivitis. Common names for this type of gingivitis are Vincent's infection, trench mouth, and acute necrotizing ulcerative gingivostomatitis, acute necrotizing ulcerative gingivostomatitis, ANUG. If these don't scare you, nothing will. Necrotizing means it's dying. So this type of gingivitis makes your gum die. It is super painful and it's quite nasty. Happens a lot in people who have poor oral hygiene, smoke, and are run down, and their immune system just can't cope with the amount of infection and inflammation, and then the bacteria start to kill and destroy your gum tissue. Acute gingivitis can appear suddenly and it's really painful, but it responds well to proper treatment at the dental office. Some of the most common symptoms are fever, swollen lymph nodes, and malaise, which is tiredness. Its visual signs are angry red and swollen gums, crater-like depressions at the edges of the gums between the teeth, and grey-coloured skin around the edges of the infection. The infection will be the infected area is painful when touched by anything, so like your finger, food, and your toothbrush. Because brushing at this stage is painful, there is a tendency to cut down on the already inefficient and insufficient oral care, and this only makes the condition worse. The infected area bleeds easy and is accompanied by a very nasty smell. This is the most serious form of gingivitis. It can involve one or more teeth. It can rapidly expand the ligament and the bone around the tooth if not treated. As in most forms of dental disease, the initiating cause is poor oral hygiene and the resultant plaque buildup. Many dental professionals, including myself, believe that lowered resistance, which is the reduced immune response, poor nutrition, stress, and probably other forms of disease share the blame in the cause for persistent acute gingivitis. The milder forms of gingivitis can be likened to smouldering coals just waiting to be fanned into acute gingivitis flames. Lowered resistance, poor nutrition, and stresses are the fan that ignite that fire. Periodontitis. This is a serious and nasty disease, and it needs to be taken very seriously. If you have this type of periodontal disease, you are at the stage where the infection has broken through the first line of defense, that being the gums, and has begun to attack the ligaments and the bone supporting the teeth. This is the stage where bone loss occurs, causing a pocket or a trough, like a gutter. And it makes that pocket, it makes that space between the gum and the tooth deepen. Periodontitis, like gingivitis, occurs in different forms and can involve parts of or all of one tooth or many teeth at the same time. Like any disease in your body, it can be treated if it's detected in its early stages. However, if it isn't treated, you will eventually lose your teeth. You can look around your mouth, and I will provide that information on what to be looking for in the next episode of the Dental Zone, and you can get an oral self-examination to get a pretty good idea if you have the disease. But any final diagnosis will be up to your dentist or the periodontist, which is the name for the gum specialist. With the right knowledge, diligent home care, regular hygiene therapy and guidance from your dentist or hygienist, you'll be able to cure periodontitis if it hasn't progressed too far. Okay, so again, let's classify this. These classifications have changed recently, and we now talk of periodontitis in terms of stage 1, 2, 3, and 4, a little bit like how we classify cancers now. So if you have stage 1, it should be easier to treat, it hasn't spread, and we can get on top of it. If you've got stage 4, then it's terminal. And all we're doing is what we call palliative care and trying to slow down the rate of spread and the eventual outcome, which in this case is the terminal loss of your teeth. But also it has many ramifications on your health. But first, I'm going to classify it in where we go from simple to complex, talk about what that looks like, and then we will move on to talk about other things to do with gum disease. Simple periodontitis. This can be found in people as young as their teenage years, but it's more often seen in people over 30, and the most serious cases are found in people over 50, but it's definitely not limited to any age group. It's characterized by chronic gum inflammation, bone loss, and deepening of the gum pocket, ranging from a little to a lot. In the advanced stages, tooth movement will occur. The tooth become loose and mobile, and they will start to drift and move out of position. The speed at which the disease advances is directly related to how well you take care of your gums, both on the outsides and in the pockets. Simple periodontitis doesn't always involve pain, but it is usually associated with some or all of these symptoms that I'm going to go into now. Sensitivity to heat and cold, sugar, acidic foods, and possibly even brushing your teeth. Sensitivity develops when you've had bone loss, because bone exposes Bone loss exposes the microscopic tubules, which are like little tunnels in your teeth in the dentine. These tubules run like pipes from the outside of the dentine into the pulp of the tooth, which is where the nerves and the blood vessels are contained. When these tubules are exposed to acid, bacteria, air, and temperature changes, these irritants cause a pain signal or a pain response in the pulp. You can get acute and sudden pain or throbbing that is made worse by tapping on the affected tooth. This symptom points to more extensive bone loss and may also be associated with a deep abscess of the gum pocket or an infected nerve. Constant or periodic bleeding. A dull, deep, almost pain-like sensation that feels as if something is putting intense pressure on the root of the tooth. Most often this is the result of food or other substances that have been jammed down into the gum pocket. It is often associated with a bad or an open contact between two teeth that allows food to be forced into the pocket. This feeling worsens the longer the irritant is left there. Toothache. Any rapidly moving decay can cause acute pain, but the toothache associated with periodontitis is usually of the throbbing variety. It is an indication that decay has started in the root and has begun to irritate the tooth's main nerve. Root decay is the only kind of decay associated with periodontitis. Then there's complex periodontitis. The primary factors associated with complex periodontitis are the same as those found in the simple variety. However, they're complicated by the stress and trauma resulting from forces exerted on the teeth of bone. Any abnormal and long-term pressure that is placed on the bone by chewing improperly, clenching and grinding can cause the bone to recede. Therefore, tooth movement is often seen at an early stage in complex periodontitis, earlier than the simple form, because the increased irregular pressure that's been placed on the tooth and bone causes the bone to be attacked both by bacteria and by the biting or occluding forces, stresses. Complex periodontitis usually progresses at a more rapid rate than the simple form. As a dentist, I often find that a bite problem is also associated with advanced bone loss. This is a bit like the chicken and egg. Which came first? Is it the bad bite that makes the existing periodontitis worse, and then the periodontitis makes the bite problem worse? Or was the bite problem there and that meant that we got some bone loss, which then led to not being able to take care of that area and periodontitis occurs? Well, it's by the point it's been diagnosed, it doesn't really matter which is doing what, you've got both. And the key is to treat the inflammation and infection and address the bite issue at the same time. Then there is juvenile periodontitis. This is found in children and young adults, often with other diseases or health conditions, but not necessarily and not always. Anything that's going to lower the resistance of the immune system and anything that causes nutritional deficiencies will interfere with the development of the bone and the surrounding tissues. Juvenile periodontitis is classified according to the location of the most severe infection, and that is whether it's found around all teeth or only involves specifically in teeth, and it often will affect usually the molars and your front teeth, not the ones in the midsection. Then there are types of periodontal diseases caused by atrophy and not being used. Periodontal disease can be caused by not having stimulus on the teeth, and both conditions can exist without any active plaque or involvement, any active plaque involvement or any active infection. Disease caused by atrophy is usually found in older people, and it is generally the result of long-term wear and tear on the teeth, on the underlying bone that supports them. Bone loss and the resulting gum recession can occur without the presence of infection. In periodontal disease caused by disuse, the ligament surrounding the tooth area is most effective. The teeth are designed to chew, and when they don't, or when they don't chew normally, they become more susceptible to disease. Over time, the ligament gets thinner and is severely weakened. This is the result of chewing improperly, eating food that is too soft, or having a misaligned bite that prevents teeth from actively participating in chewing processes. Then, if they're suddenly asked to do a lot of work, the affected ligaments could become tender and sore. So say you've had a missing tooth, the tooth opposing it hasn't been chewing for ages, then we put an implant in and we're asking you now to chew on a tooth that isn't fit to be chewed on, and it gets sore and it aches. It's no different to you've not been to the gym in ages, then all of a sudden you start lifting weights. What happens? Your muscles are sore because they're not used to being worked. Also, if you stop going to the gym and you don't exercise, the muscles atrophy and they disappear, and then you've got to rebuild them. And this is what happens when we don't chew on teeth. The bone is there because you are putting force on it, and so when you don't chew on it, the bone atrophies and shrinks away. Now, periodontitis is not something to just dismiss. It needs to be taken seriously. It is a major threat. I'm stressing the word major. It is a major threat to your health and well-being. If you have periodontitis, your mouth is in serious trouble, and you must be willing to do whatever it takes to correct the problem. You must accept that once your gingivitis turns into periodontitis, it cannot be treated and cured with home treatment alone. I am sick of hearing, oh, I can just swish with coconut oil, I can just do this, I can just do that, and my deep pockets and my periodontal disease will go away. Baloney, BS, no, it will not. You've got an infection. The infection needs to be properly treated, and it needs to be done in conjunction with a dental professional. If you want to keep your teeth, if you want to have good health, we have to work together. That means you can't do it on your own, and I can't do it for you. It's no good just coming into the dental office, I do deep cleans, I do the treatment, and then you don't play your part in between, or you think you can treat this on your own without involving a professional. If you do come and you have your gums treated at the dentist and then you change nothing, that's a bit like being unfit, overweight, unhealthy, engaging a personal trainer, going for a session, and then sitting on the couch, eating chocolate, pizza, lollies, and making no changes in your lifestyle, and then blaming the personal trainer that your weight hasn't changed or you're not any fitter. Does that make sense? This is a collaborative approach. Okay, let's look at the sad story. Let's look at periodontal disease again. Sadly, for most people, whilst your mouth is probably one of the easiest bits of your body to have a look inside of, it's like uncharted territory for most people. Most people don't look, they don't know what's going on inside there, and when they do, they don't understand. When they're told they've got gum disease or tooth decay, they don't understand why. They can't get their head around how it's happened. They don't understand how to mitigate it, they don't understand how to treat it, and they don't understand the ramifications and the importance of it. They've never examined their own mouth. They don't look in their mouth. They don't know what a healthy mouth looks like. You have little or no idea of how gum disease begins and ends. You have no idea what you're looking for. And so I'm going to describe how your mouth can go from a state of health to a state of toothless devastation. And I'm going to go through the process that very few people understand. Let's follow a tooth on its journey from a healthy mouth to sitting in the bucket in the oral surgeon's office. Keep in mind that there are literally thousands of extracted teeth. Teeth that with little care and attention could have stayed in their owners' mouths. Though gum disease can last a lifetime, the story of how it actually declines and eventuates, how it starts and how it progresses, is actually quite short. Excuse me. Let's look at what's needed for gum disease to occur. You've got to have all these in place at the same time. You've got to have teeth, the ligaments and pockets. You've got to have gums, bacteria, bone, plaque, calculus, which is tartar, food, and saliva. As in the case of tooth decay, if the participants are left on their own, in the absence of oral hygiene, you will certainly contract this disease. Teeth. Let's look at the teeth. In the ideal mouth, a mouth that has never experienced any form of dental disease, each tooth has a crown, then it has its roots, sometimes 1, 2 or 3, and the pulp, which is the nerve and the blood supply inside the roots and the middle of the crown. The crown, which is the part of the tooth that you see above the gum line, is covered by enamel, and the root, which is below the gum line, is covered with cementum, a type of calcified tissue that is about as thick as a human hair and is softer than both enamel and dentine. The crown and the root meet at what is known as the cemento-enamel junction, the CEJ. The pulp, which contains blood vessels and nerves, leads into the root canal, which in turn connects to the nerves and blood vessels in the jawbone. Ligaments and pockets. The periodontal ligament averages 1/5 of a millimetre in width and completely surrounds the root of the tooth, filling the space between the root and the bone. It attaches the root to the bone. It has a blood and nerve supply and also serves to act as a shock absorber, helping to protect the bone from forces exerted while chewing. Without your ligament, your teeth would fall out. In a healthy mouth, one that has never had gum disease, the ligament and the gum join at the cemento-enamel junction, which is where your crown and your root meet. Here's where the ligament attaches the gum to the tooth, forming the bottom of what we call the gingival sulcus or the gum pocket, like having a gutter around the tooth. The pocket, just like the pocket in your shirt or your trousers, has 2 sides. One side there's the tooth, and on the other side there's the gum, and it has a very narrow bottom where the gum and the ligament meet the tooth. Gums, or the gingiva, is really a specialised type of skin, much like the skin that covers your hands. It covers and protects the bone that surrounds the teeth. Before your baby teeth erupted, the gums completely covered both jaws. Nature, in her wisdom, allows teeth to penetrate the gums and has devised a way for the gums to stay attached to the teeth after they erupt. As long as the gums remain free from disease, the ligament keeps them attached to the root. Healthy gums hold tightly to the tooth, closing the pocket and helping to prevent food and plaque from reaching the ligament, the roots, and the extremely vulnerable underlying bone. Bacteria. As you know by now, if you've been listening to this series, your mouth contains hundreds of different types of germs. Some bacteria are more active in the gum disease process, but in general, the degree and seriousness of gum disease is directly proportional to the total bacteria population. In a healthy mouth, a small drop of saliva can easily contain 50 to 100 million bacteria, but the same amount of saliva from a diseased mouth can contain billions of these horrendous bacteria. Plaque. Plaque is an accumulation of bacteria, both dead and alive, mixed with saliva, food substances, mostly carbohydrates and proteins, dead skin cells, and the germ-fighting immune cells that have been released from the body to fight the bad guys. Initially, it forms a sticky, nearly invisible layer that attaches to the tooth but not the gums, and we call this biofilm. As it continues to grow, it takes on a whitish, grey, yellowy type colour. There are two types of plaque. They are distinguished by where they are found and their composition. The first type is called supragingival plaque, and it's found above the gum line, usually on the lower third of the tooth or the upper third for the top teeth, with most of the deposits found in or close to the gum line, which we call the gingival crevice. The second type of plaque formation is called subgingival plaque, and yes, you've guessed it, it forms below the gum line and it is found in the gum pocket. The main difference between the two types of plaque is that the subgingival below the gum line plaque contains more kinds of bacteria than does the one that sits above the gum. This is because the bacteria in the pocket are protected from most of the cleansing done by the tongue, the saliva, and your toothbrush. The pocket supports more germs in general, and most of the nastier ones in particular. Along with the fact that it is more difficult to keep the pocket clean and healthy than it is to keep the gums around the outside of the teeth clean and healthy, this means that subgingival plaque is the more serious and concerning kind of the two varieties. If you didn't have a germ in your mouth, you would not get the infectious forms of periodontal disease. Likewise, if you never formed plaque, you wouldn't get them either. And this is why we talk about brushing and flossing. It's to break down this plaque. It's to limit its formation, and it's to ensure that whatever bacteria build up don't start colonizing your mouth to become more predominant, more prevalent, increase in numbers, and increase in their nastiness. Calculus, or to you, tartar. Calculus is what plaque is called after mineral deposits make it calcify. Calculus is composed of inorganic compounds, mainly calcium phosphate, with traces of other minerals. The rest is of organic nature: skin cells, dead bacteria, germ-fighting cells, various carbohydrates, proteins, and sometimes a little bit of fat. The easiest way to visualize how plaque turns into calculus is to think of a coral reef. Coral is composed of living organisms and is soft. Then, because it stays in one place, minerals accumulate and it calcifies. Calculus is just oral coral or limescale that builds up in your kettle or in your shower. Plaque not only creates the matrix from which calculus starts, but once calculus forms, plaque collects on top of the calculus after it has hardened. And this ongoing process builds layers. It's like building the coral reef. First you have plaque, it hardens to form calculus, then more plaque forms on top, hardens to form more calculus, and so on and so on. The rate of calculus formation depends on your diet, your saliva, and your oral hygiene. Left unattended, it can begin to form as in shorter space of as little as 8 hours or so. So you get plaque forming, and you can start to mineralize that within about 8 to 12 hours. All plaque does not necessarily undergo calcification, but if you are susceptible to forming calculus, your plaque can become 50% mineralized within only 2 days, and then anywhere from 60 to 90% mineralized in as short a space as 10 to 12 days. And then you can't clean it off. It is rock solid and bound to your tooth, and this is where we as the dentist or hygienist have to use our instruments and tools to chip and break that away and scrape it off your teeth. Now, food. We've got to make a distinction between the type of food that causes decay and the type of foods that promote plaque formation. Decay can only take place in the presence of sugar. while any type of diet will contribute to plaque formation, including a high protein, a low fat, or a carbohydrate-free diet. In fact, plaque formation can take place even if no food is present. Therefore, if you just remove sugar from your diet, it doesn't mean you're going to eliminate plaque. But it will help, because a soft, sticky, processed and overcooked diet, one that is high in refined carbohydrates, is the biggest promoter of periodontal disease. But quite simply, any food left in your mouth will contribute to plaque formation, and a diet that is high in sugar will increase the amount and rate at which plaque forms. Also, a diet that is high in sugar is going to weaken your immune system. A diet that is high in sugar is going to be most likely nutrient deficient, and you're going to have problems with your gums because you're not getting enough things like vitamin C, zinc, vitamin D, iron, B vitamins, which are all crucial building blocks for your gums and also there to maintain the health and well-being of your gums as well as the rest of your body. Saliva, the nice spitty drooly stuff. Saliva plays a really positive role in preventing tooth decay and periodontal disease. But once plaque has been attached to your teeth for more than 24 hours, the many minerals that are found in your saliva actually contribute to the formation of calculus. So saliva helps protect your teeth, but if you don't clean the plaque away, it will increase the rate at which calcification and calculus buildup happens. And then you are the one who's going to decide how much you contribute to gum disease or not. Or more correctly, how well or how poorly you take care of your mouth. Knowing what causes gum disease will help you tremendously when it comes to preventing it. It can be very frustrating, it can be discouraging and demoralizing when you think you've been doing everything you should to take care of your teeth and gums, to find out that you still have disease. Unfortunately, what tends to happen though is although you were taking the effort, you didn't know the proper way to take care of your mouth. You didn't know how to do it the right way or at the right time or with the right tools. And I include tools in that. One of your tools is your relationship with your dentist and your hygienist, because your disease will always be worse if you don't see your dental professional on a regular basis. And now that you know something about what's involved with the story of periodontal disease, let's see what takes place when this is all put together and it goes on in your mouth and you have what I call the perfect storm for gum disease. Okay, well, we're getting through this. We're getting through the underlying understanding of what gum and periodontal disease is, the combination of things that are required for it to happen and why it happens, and that the biggest factor is poor oral hygiene, which is great to know that because that means we can do something about it. Now, we're almost, about 50 minutes into the show. If you need to just pause, have a little break to reflect, and then we'll get into the next stage, which is actually talking about the disease process itself. And then you'll have a better understanding of what's happening and you can empower yourself to make some changes. So I'm Dr. Rachel Hall, holistic dentist. If you want to know more, then you can give my office a call on 0737 201811 and we'll get you booked in for a consultation where we do a thorough mouth examination, including your pocket measurements and periodontal health assessment, so we can help you know exactly where you're at with your gum health, and then we can treat your symptoms accordingly and set up a at-home regime and treatment protocol that's going to support you to cure yourself of this problem. So let's get into the next part. Let's have a look at what takes place. So at the beginning, there was plaque formation. All periodontal disease begins with the formation of plaque. In other words, without plaque, you don't get gum disease. You don't get gum disease unless you have plaque. Plaque is initiated when millions of disease-causing bacteria attach themselves to the tooth by releasing a glue-like substance. These bacteria can attach to what appears to the naked eye as a perfectly smooth tooth surface, but to these bacteria, it is actually more like a potholed road. They especially love areas of the tooth that don't get cleaned properly. Little rough spots where decay has already started microscopically, the pits and the defects and the grooves within your teeth, and any fillings that overhang or are deficient at their edges. They also love the gingival crevice, which is the little groove where your tooth meets the gum, and the gum pocket, because these areas offer them a protected place to hang out. But bacteria alone, even those that initiate the plaque formation, no matter how many are attached, are not considered plaque. At this stage, this is called bacterial biofilm. But as more and more germs congregate, they're able to hold on to other materials that is like the scaffolding and the building blocks that they acquire that contribute to plaque formation. These are food particles, minerals, and other bacteria. Once all the ingredients have joined together, and this can occur in as little as 1 hour after brushing, you've officially begun to form plaque. At this point, and up to about 4 hours after, this sticky and nearly invisible substance has formed on your tooth surface. The plaque is at this point still very vulnerable to all forms of oral cleansing. So that's brushing, flossing, mouth rinsing. Water pick as well. Picksters, the little brushes you use in between your teeth. But if you give it more than 4 uninterrupted hours to establish itself, it becomes a little to a lot tougher to remove. Left longer than that, plaque can adhere pretty tightly and solidly to your tooth, and in most cases, even brushing won't remove it. You may scrape off the top layers, but the part that's firmly attached to the tooth will usually remain. And then this makes it easier for the next layer of plaque to form. And it can begin to do so immediately after your next brushing. Plaque can form in the absence of food, so even if you fast, you still need to brush. Now, don't give up. Don't think, oh, well, what's the point then if the plaque's always been there? Don't give up, because the more you can disturb that plaque, the less likely you are to have ingression of plaque under the gum line and have the more nasty and aggressive types of bacteria. So how do you resist the plaque invasion? Well, this is what happens next. That bacterial plaque starts to form at the gum line. And what happens is your body musters its defense forces to fight off and battle that bacteria. So your immune system gets triggered. Bacteria come into contact with the gum and they release toxins that irritate and inflame the gum tissue. That inflammation stimulates the release of germ-fighting immune cells into the immediate area where plaque is formed, causing an increase of blood flow to the surface of the gum, which causes the gums to swell. And a little battle between health and disease has now begun. It's your body's defenses versus the plaque bacteria. The result is a buildup of millions of dead bacteria and millions of used up dead defense cells. As the fight continues, the debris of the battlefield is added to the growing plaque, and more plaque is formed. Once this has begun, the process goes on minute by minute, hour by hour, until you step in to have the plaque removed and you control the bacterial population, or until your teeth fall out. There's no better way to overcome plaque than to lose your teeth, because if there are no teeth, plaque's got nowhere to go. Within a few days, the germs that were firmly and the gums, let me just say that again. Within a few days, your gums that were once firm and healthy begin to lose their tone and elasticity. They become saggy and baggy. As the infection proceeds, their gums lose their ability to grip firmly around the tooth gum line, and the pocket between the gum and the tooth loosens and becomes more accessible to the invasive plaque. The plaque on the teeth now spreads in all directions and begins to push into the pocket. As it does so, it comes into contact with the more gum tissue and the inflammation process expands. An ever-increasing number of your body defense cells are now called upon to resist the germs. And without your intervention, your body's natural defenses may win a few battles, but in time, they're surely going to lose the war. They are just not able to defend themselves properly from the amount of plaque, inflammation, and bacteria. The formation of calculus. Within as little to 8 hours after it has begun, this massive onslaught of bacteria-filled plaque moves to the next stage. The proportion of the plaque that lies next to the tooth begins to mineralise, and you have the beginning of calculus or tartar. The mineralised layer of calculus bonds to the tooth even more powerfully than plaque. The more plaque becomes calcified and starts to spread in all directions, pushing onward and outward against the gum tissue, while simultaneously making its way into the extremely vulnerable gum pocket. New plaque is constantly being formed on top of the ever-spreading calculus. As more gum tissue comes into contact with the plaque and calculus, the infection intensifies, and the substance that holds your gum cells together is weakening. This weakening makes the gums more fragile, and soon the gums are no longer able to protect themselves from even the mildest forms of stimulation, such as brushing and eating foods, and as a result, bleeding takes place. Once bleeding starts, the germs get an additional source of food. The blood and other body fluids that are now being released from the gum tissue at an alarming rate now become a source of their diet. Certain types of germs will penetrate the gum tissue. This infection process is no different from what happens when you cut your finger. The germs normally found on your finger and in the air are normally unable to penetrate healthy, intact skin. But once you've got a cut, invasion will occur and you get an infection. Now, it should be noted not everyone forms calculus, and people who do will form it at differing rates. Although calculus contributes to gum disease, you don't need to form calculus to get periodontal disease. All you need is a poor diet, poor oral hygiene, and plaque buildup. So what's the next step? Your gums have become swollen, they've become infected, they've lost their tightness, the structures that hold the gums together have become weakened, and now we've got gums that are peeling away from the teeth and they bleed very easily. Well, once plaque begins to form in the pocket, it is protected against most forms of oral hygiene. Once it's in that pocket, your brush, your floss, your mouthwash do not get down into there very effectively. And once it moves, as plaque moves into the once healthy gum pocket, the infection begins to involve the place where the ligament attaches to the tooth and where the gum attaches to the tooth surface. Infection here is bad enough by itself, but the whole process is made even worse when you get the formation of subgingival, below the line calculus. As the calculus grows and spreads, it pushes against the swollen gum tissue. The new plaque, which is continually forming on top of the expanding calculus, comes into contact with areas of gum tissue that are still healthy. When this happens, the inflammation and infection spread more rapidly than ever. When the infection reaches the place where the ligament attaches the gum to the tooth, the ligament is forced to let go of its hold on the tooth surface, and the pocket now begins to deepen. In essence, the calculus acts as a scaffold by which the plaque gains access to the surrounding gum tissue. Like getting dirt under your fingernails. If that got infected, you'd have dirt all the way down to your nail bed. And this is what's going on. You're getting dirt building up under your gum, and that dirt contains bacteria that creates inflammation. It creates irritation. Your immune system then tries to fight it, and you get more buildup of plaque and tartar, and it just goes deeper and deeper under the gum, destroying the tissues as it goes. So how does gingivitis become periodontitis? Well, once the infection involves the ligament that holds the tooth to the bone, you have officially moved from gingivitis to periodontitis. As the infection destroys the ligament, both the root and the bone are exposed to the bacterial hordes and the toxins they release, and to the deadly plaque and calculus. Periodontitis and root decay go hand in hand because the thin soft layer of cementum that surrounds the roots and the vulnerable dentine underneath it are directly exposed to the acid-producing germs found in the plaque. The bone surrounding the tooth is now at risk. The bone of the jaw is extremely susceptible to any form of irritation and infection. The bone resists the invasion on its own in the best way it knows, but without help from you, the hygienist and or the dentist, it is overwhelmed and soon has to retreat. The retreat begins when osteoclasts, which are the cells that dissolve bone, start breaking down your jawbone to remove it from the plaque invasion and its accompanying germs and toxins. This is how bone loss occurs. Prior to this stage, the battle was raging on the outer surfaces of your body, but now the battle has moved deeper within because the first line of defense, your gums, has been breached. As the bone recedes, the pockets deepen. More plaque is formed on top of the continuously growing calculus. And again, the disease progresses and the process accelerates. Over time, as more and more bone is lost, the tooth begins to loosen. This loosening is accelerated and expedited by chewing because there's not enough bone supporting the tooth to resist the tremendous forces of biting and mastication, which is the process of chewing your food. Eventually, the tooth becomes loose enough to wiggle in your fingers, and the once inaccessible opening between the tooth and the gum becomes a bacteria superhighway. Now, everything you put in your mouth has direct access to the bone, the gum tissue, and the roots of your tooth, things that should never be out in the open world. More food is packed in, more bacteria are born, and more plaque and calculus are formed. And now there is very, very little you can do about this on your own. If left untreated, the disease will soon pass the point of no return, and it will be too late to save your tooth. Once the framework that holds the bone cells is lost to gum disease, new bone won't form to replace what has been lost, even after you get rid of the disease. At this critical stage, the damage is irreversible. If the tooth is not pulled, it will eventually just fall out. And there you have it. There's the story of gum disease and how it can take a perfectly healthy tooth from your mouth on a long and painful journey into the bin. If you let gum disease go too far, your story will end in the same unhappy way as it has for billions of people who are now toothless. If you're not yet concerned about this disease, you should be. And knowledge gives birth to hope and motivation. And in the next episodes, I'm going to give you the knowledge that you need to do something about this disease. Now, it's not just your teeth that are at risk from gum disease. It is the rest of your body. That amount of inflammation that's going on in your mouth that would cover a sheet of A4 paper is not localized to your gums and your jawbone. It spreads via the blood vessels and your lymphatic system to the rest of your body. Those bacteria are like cars on the motorway, on the freeway, and they will lodge and stop in other parts of your body, like in your cardiovascular system, in your arteries, in your heart, causing cardiovascular disease, heart attacks, strokes, increase in blood pressure. It will travel to your brain. It's been linked to Alzheimer's and dementia. The inflammatory byproducts are linked to increased cardiovascular disease, there's increased cancer, diabetes, and a lot of systemic health issues. It is really super important that we take gum disease seriously and that we teach you how to identify it, how to address it, how to treat and manage it, and how to prevent its return once it has been treated. This is something that dentists do not take seriously enough, and therefore you, the patient, the general population, also don't take seriously enough, because the message is not getting across that if you have gum disease, you have a systemic health issue. You have chronic inflammation and chronic infection that is setting you up for poor dental health and poor overall health. My goal is to help you improve your dental health and your overall health and prevent you from having these nasty infections that are entirely preventable and treatable. Thank you for joining me. This is the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Hop on over to holisticdentistry.au to find out more about what holistic dentistry is and about safe amalgam removal, to find out more about the oral systemic health link, gum disease, and other factors that affect your oral health and your overall health. Then hop on over to evolvedental.com.au to book in and see me to have a consultation about your dental health and your gum disease issues, amalgam removal, and anything to do with dental health. Then give our rooms a call, 0737201811, and I'll look forward to seeing you and helping you. And in the meantime, let's stay in the zone. You can check out the other podcast shows and episodes. And thank you for being with me on this journey. We are now in our second year, and let's just bring more and more to help you have a healthy smile and a healthy life. Until next time, I'm Dr. Rachel Hall. Stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.